Magnesium and calcification. A healthy cell has high magnesium and low calcium levels. Calcium can lodge anywhere in your body and cause serious harm if not balanced with magnesium, which regulates the action of calcium. For instance, excess calcium buildup around your bones and joints mimics arthritis. Too much calcium lodged in your heart imitates arterial lesions. Calcification or calcium poisoning can manifest as heart disease, cancer, wrinkled skin, kidney stones, osteoporosis, dental problems, bone spurs, cataracts, and many other health problems. Calcium and magnesium are opposites in their effects on our body structure. As a general rule, the more rigid and inflexible our body structure is, the less calcium and the more magnesium we need. Dr. Gary Gordon wrote, "If you have compromised cell membranes or low ATP production, in other words, not enough ubiquinol, for any reason, then the cell has trouble maintaining the normal gradient. This is because the usual gradient is 10,000 times more calcium outside of cells than inside. When this is compromised, you will have increased intracellular calcium, which seems to always happen at the time of death. Whenever intracellular calcium is elevated, you have a relative deficiency of magnesium. So whenever anyone is seriously ill, acute or chronic, part of your plan must be to restore magnesium, which is poorly absorbed through oral means. The ratio of calcium to magnesium is vital for cell membranes and the blood-brain barrier. Countries with the highest calcium to magnesium ratios, high calcium, low magnesium, in soil and water have the highest incidence of cardiovascular disease." Wow, big surprise, huh? Doesn't that kind of say it all? At the top of the list is Australia. Wow. You would think it would be the US, but nope, it's Australia. Never knew that. Glad I read this. In contrast, Japan, with its low cardiac death rate, cites a daily magnesium intake as high as 560 milligrams on average. Adequate levels of magnesium are essential for the heart muscle. Those who die from heart attacks have very low magnesium but high calcium levels in their heart muscles. This is absolute fact. Patients with coronary heart disease who have been treated with large amounts of magnesium survived better than those with other drug treatments. Duh. Not surprising, is it? Shouldn't be surprising by now. Magnesium dilates the arteries of the heart and lowers cholesterol and fat levels. Nobody can deny this. Nobody can deny this. Magnesium taken in proper dosages can solve the problem of calcium deficiency, says Dr. Nan Catherine Fuchs, author of The Nutrition Detective. It is magnesium that controls the fate of potassium and calcium in the body. If magnesium is insufficient, potassium and calcium will be lost in the urine, and calcium will be deposited in the soft tissues, kidneys, arteries, joints, brain, etc., where it's not supposed to be. Magnesium and calcium compete for many of the body's chemical pathways. Calcium causes muscles to contract, while magnesium helps them relax. Magnesium and calcium are paired minerals. Several studies have reported that increasing calcium in the diet significantly reduces the absorption of magnesium. Yeah, so the more calcium you get, the less you can absorb magnesium. Evil, evil, evil. Calcium intakes above 2.6 grams per day may reduce the uptake and utilization of magnesium by the body and increase magnesium requirements. 2.6 grams a day? That's like more than twice the recommended amount of calcium. Who would get that much? I'm sure lots of people get that much. So much stress is placed on the importance of calcium by the dairy industry that we may in fact be harming our magnesium absorption. Up to 30% of the energy of cells is used to pump calcium out of the cells. A healthy cell has high magnesium and low calcium levels. Remember, that was stated initially. The higher the calcium level and the lower the magnesium level in the extracellular fluid, the harder it is for cells to pump the calcium out. Well, that makes sense, I guess. The result is that the mitochondria gradually calcify and energy production decreases with low magnesium levels. Our biochemical age could theoretically be determined by the ratio of magnesium to calcium within our cells. Okay, if that isn't profound, what is? Had you any clue? Even I didn't suspect it was, that elemental. And yet these don't sound like things that are really that hard to prove. Without sufficient magnesium, calcium can collect in the soft tissues and cause arthritis. Okay, it can no longer be denied. In fact, who would have thought? Arthritis is caused by too much calcium, not enough magnesium. In arthritics, calcium is poorly absorbed into their blood and bones. Sounds paradoxical. Too much calcium caused the problem, but now they can't absorb the calcium efficiently anymore. So they become, quote, calcium deficient. Some researchers estimate that the American ratio of calcium to magnesium is actually approaching 6:1. Of course, what do you expect? While the recommendation for healthy living is actually 2:1, which is still too high, as you know. But even 2 parts of calcium to 1 part of magnesium is probably too high, yep. Since current research on the Paleolithic or caveman diets show that the ratio of their diet was 1:1. Wow. Starting to make the more sense the more you hear, doesn't it? Medical authorities claim that the widespread incidence of osteoporosis and tooth decay in Western countries can be prevented with a high calcium intake. Oh, because we're not eating nearly enough calcium, even within a ratio of 6:1. However, Asian and African populations with a low intake, about 300 milligrams of calcium daily, have very little osteoporosis. Pay attention to that. How do such facts get ignored to this degree? Bantu women with an intake of 200 to 300 milligrams of calcium daily have the lowest incidence of osteoporosis in the world. And yes, these claims do have citations after them. So read this. In Western countries with a high intake of dairy products, the average calcium intake is about 1,000 milligrams. Oh, but that's not high enough because we got osteoporosis everywhere. It's only what we see in the U.S. that determines the truth of nutrition for all humans. God, this just makes me so mad. You know what? No, actually, it just excites me because this is the truth, and I'm getting it out there, and that's what matters. People are going to care when they hear this truth. They can't deny it. Well, some of them will try, I'm sure, but yeah, you get the idea by now, I'm sure. Shall I continue? Why not? With a low magnesium intake, calcium moves out of the bones to increase tissue levels. Wow, that sounds useful, huh? Well, actually, yeah, it is useful because your tissues do need calcium. Ah, I see now. So, okay. When you have low magnesium in your tissues, your bones somehow sense that, and they send the calcium out of them and to go into the tissues because apparently it's more important to be in the tissues than in the bones. Well, that too makes sense, right? Of course. And then, while a high magnesium intake causes calcium to move from the tissues into the bones. Thus, high magnesium levels leads to bone mineralization. Wow. I mean, this is just undeniable fact, and how much is this taught? How much do people actually know about this, even including doctors? I'm afraid to find out. I'm afraid it's extremely low. And how does that happen? How does that happen by accident? Well, we can worry about that later. Dr. Karen Kubena, Associate Professor of Nutrition at Texas A&M University, indicates that even if you monitor your magnesium level closely, you're still at risk for migraines if your calcium level is not balanced. It seems that higher than normal blood levels of calcium cause the body to excrete the excess calcium, which in turn triggers a loss of magnesium. Let's say you have just enough magnesium and too much calcium in your blood. If calcium is excreted, the magnesium goes with it. All of a sudden, you could be low in magnesium, she says. Unquote. If calcium is not taken with enough magnesium, it will cause more harm than good. The unabsorbed calcium can lodge anywhere in the body and provoke practically any disease. Well, okay, if it can be proven that this information is intentionally hidden from as many people as possible by some elusive overlords, well, they may as well be trying to kill as many people as possible, right? Because that is the outcome. For instance, if it lodges in your bones and joints, it leads to some form of arthritis. That's right, calcium lodging in your bones and joints. That is not the same thing as having it in your bones in the right places. If it lodges in your heart, it leads to arterial lesions. If it lodges in your lungs, it provokes respiratory problems and more. Despite the crucial relationship between calcium and magnesium, a recently published study announced that most U.S. children don't get enough calcium in their diets, and pediatricians should intervene to help remedy the problem. Okay, I gotta stop here at part 1. I mean, just what I've read so far is more than enough for anyone. Increase magnesium dramatically, decrease calcium dramatically. See what happens. Especially if you have osteoporosis, or arthritis, or both. Or hell, any disease apparently. Unless you're one of those rare people that doesn't get way more calcium than magnesium. But even then, yeah, you know what I'm saying. Okay, bye, until part 2.